She has some scars on the cheeks, both sides, which, what have you done before maybe?
Fat transfer.
Okay, fat transplantation only. And we're gonna use the threads. You won't see much result right now, but we want you to send us pictures after 3 months. Yeah, and there will be better texture of the skin. It will be much less scarring, and you will see that there's something there which makes you look more fresh and yeah. Okay. So this is actually a very good patient for threads. It will hurt a bit more, so always explain that to your patients, that this is gonna hurt on you because there's a lot of scarring underneath, which makes it more resistant to put in the needle. And I'm gonna use the same, you can lay down now. I'm gonna use the same technique as we did on the first patient with the face, just on the cheeks and nothing more. It's not gonna be that many threads, just to produce the collagen. And no lifting, so only 29 and 27. Okay. So here, the same technique that I'm gonna put 27, 27, 27, and 27 here. And here, maybe down here. And then stabilize these with the 29. Sorry. If you like to draw, always draw on your patients. I sometimes do it, I sometimes don't, because sometimes I get like confused with the drawings on the face, but I will do it now just to show you. And remember to always go upwards. Okay, ready? All right, we'll start with this 27. Is it okay? On her, I feel more resistance than I did on the first patient. And here's the needle. I recommend that you always use your fingertip to feel where the thread and the needle is. And if you feel the resistance, it's actually good, because then you know you're in the right place and you have to open it up. Did it hurt a lot?
No.
No?
Just a bit.
Okay. So I'll take these out so it feels better for you.
It is quite numb.
It is. And you always, or most patients feel the numbness 3 days after a treatment like this. And that's totally okay. Down here it was easier. There's not that much scarring.
If you have a patient with only unilateral scarring, only one side,
Yeah?
do you have to treat both so that you get an even result, or is there...
No, you can do just one side. There won't be that much difference, no. But if you do one side, it's usually that you want to do the other side too. Did you have a question? No? Okay. And you can also treat the chin if you have scarring here, but that hurts a bit more. And you can use only the 29 down here, I recommend. And it will create a really good result that as well. And now the pink ones. Thank you.
This is the 29.
Yeah, 29. These are smaller.
May I see?
The thread is here.
Yeah.
Was it okay?
Yes. Super. Oh, well.
Sorry.
Do you notice any scarring when you're putting in the... Can you feel that there's some...
Yeah, I feel resistance.
Yes.
The first ones, which I used, the first threads, I felt a lot more. Now when I'm using the other ones, it's a bit better. Maybe it could be because these are smaller, the needles, but also because I've opened up some of the scarring. And to get like a really good result of this, sorry, I recommend also doing mesotherapy. You have the same here? Yeah, for this.
TRP?
Yeah.
How long after the threads?
Sorry?
How long after the threads?
You can do it, yeah.
Immediately thread.
It stimulates the collagen even more. Or the fibroblasts to produce collagen. There was no here. They're a bit swollen here. So now on the other side. How do you feel? You're okay? Did it hurt a lot? So I've used the 8 of the 27 and
You want me to give it?
oh yeah, thank you. And then 10 of the 29. And I think that's actually enough for her. Ready? Actually, I want to be there.
All in all, you will use 36 threads, correct?
Yeah. Okay, I'm going to start now.
With the 27, do you go on a deeper level?
Sorry?
With this one,
Yeah.
are you going on a deeper level?
It's the same level.
The same
actually.
level, under the dermis?
Yeah.
Because this one,
Mm.
it hurts less.
It hurts less. This one.
Strains.
Okay. It's very strange because I can feel more with these ones.
I don't know.
Do you
Yes,
Huh?
I can feel the resistance.
Oh, you do it? Yeah. Can you see on the screen that it's a bit harder at some places? Sorry. The 27 ones are, I prefer them the best. These are my favorite ones. 29, they give a nice texture and everything, but you have to use less with the 27 ones. And of course, I really like the barbs for a nice lift. Oh yeah, you have them there. Okay. sorry. Or soon done. And now I'm using a bit more just because I have 4 or 5 left. So once you open a package, you have to use them or throw them away. Not a big one, but the sterile small ones. So I usually do that with my patients. I give it like for complimentary. Maybe you can take some on the other side. You have
for you to put a couple of barbs as well, so that we see just a couple of them.
Not on her, I wouldn't do it, but
Don't have a problem, she's my friend.
if I can do it on anyone, any volunteer or something. Okej. Vill du Embla kanske? Ja.
Just a couple of them, just the way you put the barb.
Okej. Vi kan köra. Så. Oops, sorry. So we used approximately 70 threads totally on her, and not for lifting. It gives a bit of lifting effect, but mainly for the collagen. And in some months you will see a difference. Or maybe you who know her will notice that there's something there.